While anticoagulants minimize the risk of developing a blood clot, they may increase your risk of bleeding. It is important that you can recognize the signs of bleeding and notify a healthcare professional if you are experiencing any of the following: dark brown or black tarry stools, red or brown urine, abnormal bruising, abnormal bleeding from the mouth that may look like coffee grounds, bleeding gums, or symptoms of a stroke such as facial drooping or one-sided weakness. Please notify all healthcare providers managing your care prior to stopping or starting any medication, including all of your doctors and pharmacists. The Anticoagulation Clinic phone number is 1-866-668-9040 and is listed in the information packet you received. Anticoagulants must be monitored by a healthcare professional after discharge. It is important to take your medication as directed and do not stop taking your medication without talking to a provider or anticoagulation pharmacist. For patients on Warfarin, which is also known as Coumadin, the Anticoagulation Clinic pharmacists are available to help with your Warfarin after you leave the hospital. You will need to have your blood checked regularly while on this medication. Best of luck with your surgery, and thank you for allowing us to take care of you.